there are three basic parts in the medical terms. So we're looking at the root word, which is usually the middle word, and then the central meaning of that whole word. We're looking at prefixes, which is at the beginning, and suffixes, which comes at the end. Okay, so when we talk about prefixes, the prefixes usually identify the subdivisions or part of the central meaning, whereas the suffixes, it modifies the central meaning as to what or who is interacting with it or what is happening to it. So an example is myocarditis. Okay, the prefix for this long super word, this super long word is myo, which you need to know that myo means muscle. To be able to look at a term and actually define it without looking it up in the dictionary, if you learn the prefix, suffix, and the root words, you'll be able to actually know what you're dealing with. So for example, in this word, myo means muscle, cardi means heart, and itis means inflammation. You will probably recognize that itis is on several medical terms. That is because it's some form of it's actually giving you an explanation of some form of inflammation. In this case, it's inflammation of the heart muscle. Okay. And other fundamentals that I want you to look at is, for example, if we change the prefixes or the suffixes, okay, myocarditis is inflamed heart muscle layer. Okay, if we call it pericarditis, it is the outer layer of the heart inflamed. Endo means inside, inner layer, inflamed inner layer of the heart. And I'm not going to spend too much time actually, I'm just going to do a quick review, that way you understand what prefix, the root, and the suffix is, the medical terms, okay? Because I feel like it does help you translate some of the words. Okay, changes of suffixes, as we'll see on here, is cardiologist, which we know is a doctor who specializes in the heart. Cardiomyopathy is damage to the muscle layer of the heart, and cardiomegaly is enlargement of the heart, because we said cardi is heart. So all these have to do with heart, but then what changes is actually the ending of that specific word. Again, no heart terms have been entered yet. These fundamentals are just to introduce the pieces of medical terms and demonstrate how moving the pieces modifies the central meaning without changing the root word. Okay, that's what we're trying to show you here. Now, common prefixes and suffixes. So itis, as I mentioned, that means inflammation. So you have seen it in words such as tonsillitis, appendicitis. Ossis is abnormal condition. Okay. Cyanosis, blush in color due to cold or low oxygen. Ectomy is actually to remove, basically. So you've seen this probably in appendectomy. Okay. An is without or none. So anemia means literally no blood. Okay. Graphy or graph is registering an image. So you've seen that as mammography, an image of the breast, because memo means breast. And so then if you look at the ending, it's graphy. So it's an image of the breast, basically. Gramma is the image. It's an x-ray. Okay. So mammogram. Otomy, it basically means cut. Okay. Ostomy is to make a mouth. So other common prefixes are micro means small, macro means large, megaly, increased. We had seen this already. That means increased. Okay. Scopy, to look or observe, colonoscopy. Ologist, ology is a person who studies or specializes in. In this case, if you put cardiologist, it's going to be probably the heart doctor, and then nephrologist. Okay, you kind of get it. Okay, so you always have to look at the prefix, suffix, and the middle word as well. So now let's dive into the medical terms that you may run into in medical terminology. Mouth, we already know that's boca. Teeth, we discussed, that's dientes. Tongue, lengua. Gums is encías. Brain is cerebro. Stomach is estómago. Intestine is intestino. Large intestine, intestino grueso. Anus, rectum, ano, recto. Liver, hígado. Kidney is riñón. We knew that one as well, and so did we also know hígado, correct? So this should be review. Some of these terms are review for some of you that took the time to actually learn the medical terminology that was in video 1. Testículo is testicle. Uterus is útero. Uterine tubes, trompas uterinas. Skin is piel. Breast is seno. Bones, huesos. Heart, corazón. Bladder, vejiga. Nose, nariz. Veins, venas. Lung, pulmón. Blood, sangre. Ovary is ovario. All right, when we talk about circulatory system, we're going to talk about cardio is heart. Brady, tachy, slow and fast. It describes basically slow or fast. Okay. Angie, glass. Angiography. Okay, and then veno, PHLEB, vein. Stasis is stop. Little is cell. Emia is blood. So now when we look at the Spanish term, cardio is cardio. Okay, which means corazón. Brady, taqui, which means lento, rápido, slow, fast. When we talk about glass, vaso. Veno, flebo, vena. Okay, when we talk about the veins, vena. Éstasis, detener. Cito, célula. Emia is sangre. Okay, cardiologist is cardiólogo in Spanish, which is a doctor who specializes in diagnosing and treatment of diseases of the circulatory system, especially the heart. However, after diagnosis, he, she may refer you to a cardiovascular surgeon. A cardiologist does not do surgery. Okay, hematologist, hematólogo. Okay, that is a doctor who specializes in diseases of the blood. So hematólogo specializes in the blood. Here is this interesting word again. So electrocardiogram is actually electrocardiograma, which is the EKG. Which is basically a picture of the heart's electrical activity recorded. Okay, so it's an instrument that you use to actually do this. Echocardiografia is echocardiography. It's using ultra high frequency sound waves beyond the human ear, similar to sonar, to form a picture of the inside of the heart. This procedure can show valve damage, birth defects, before birth especially, and other abnormalities. So then we also have cardiac catheterization, cateterismo cardíaco, which is a long hollow tube. A catheter can be threaded into an artery to the heart. Then X-ray opaque material can be released in the bloodstream by imaging the heart of the coronary artery details. It is generally used to identify blockage and location in the coronary circulation. So, and then we have phlebotomist, okay, which is also known as venipuncturist, and that in Spanish is going to be flebotomista. Okay, and this person is actually trained to draw blood for lab tests and may also be able to start IVs. Okay, the Greek and Latin versions of cutting into the vein. So let's go over these real fast. In Spanish, cardiologist, cardiólogo. Hematologist, hematólogo. Electrocardiogram. Electrocardiograma. Echocardiography. Echocardiografía. Cardiac catheterization. Cateterismo cardíaco. Phlebotomist. Flebotomista. All right, so now let's talk about, we're going to talk about términos del sistema respiratorio, which is terms of the respiratory system. Rhino is nose, okay. Larynx, okay, that's the voice box. Trachea, the wind tube, rough airways of the lungs. This word here, pneum, breathe, air, lung is what it's describing. And then we also have pulmón, which is lung. And my alarm is actually going off right now, so I'm going to turn it off. There we go. I'm sorry for that distraction. Pulmón, we said is lung. Pulm is lung. Okay. Let's see if I can go back. There we go. All right. Plasty is reconstrucción. We've got rhino in Spanish. So if we say nose, nariz. Larynx, voice box is caja de voz, laringe. Trachea, wind tube is tráquea, tubo de viento. Airways of the lungs, caminos del aire de los pulmones. Breath, air, lung. Aliento, aire, pulmón. Aliento, aire, pulmón. Okay, lung, pulmón. Spitting, coughing escupiendo, tosiendo. Okay. Reconstruction is reconstrucción. Okay. So now let's talk about the kidney. Normally we'll look at nephritis, renal artery. We're looking at the prefix for neph, which is riñón. We have for water, it's hydro, and so it's agua, hidro. Bladder is cyst, vejiga, cyst, quiste. Renal collecting ducts, skin. Okay, we've got piel, conductos electorales, colectores renales. Urine is or urea, orina. We've got escaso menos de lo normal, which means scarce, less than normal. We've got it right here written, escaso menos de lo normal, which is olig. Okay, oliguria, reduced urine formation is what that means because we're looking at the prefix. Okay, and if we continue to talk about prefixes or suffixes, we're actually going to also look at pexi. Okay, so for example, in this suffix, it's fixation of the kidney surgically in a normal anatomical position. Nephropexy. Okay, and that is volver a pegar quirúrgicamente, fijar en la posición normal, pexia, nephropexia. So you would say nephropexy is nephropexia. Okay, here's more words that we've already gone over. Some of these, not all of these. Bone we know is hueso, which is osteo. Okay, we also have cartilage, cartílago. Okay, which is condr, condritis, condroma, condrocito. Joint is articulación, which is arthritis, arthritis. We have bone marrow, which is médula ósea, mieloma, which is miel. Okay, we have tendon, which is tendon. Okay, tendinitis, for example, is a prefix. Ten is a prefix of that. The next one is ligamento, which is ligament. That's joints, bone to the bone. Ligament, ligamento. Okay, and then we also have bursa, which is bag. Bursa in English is bag. And bolsa in Spanish. Okay, like bursadas, B-U-R-S is the prefix. Muscle is músculo, which is the prefix is mi, mioma, myositis. So if we look at this, if we're looking at myositis, okay, myositis right here in English, itis we know is inflammation. Okay, so it's catching those prefixes and suffixes. Softening is ablandamiento. Okay, poroso, porous, osteoporosis in this case. So if you see this word in Spanish, you're going to know that it's osteoporosis. We have weakness, loss of strength, debilidad, pérdida de la fuerza. Find the suffix is astenia, miastenia. Okay, so if you see that, you're going to recognize the suffix. And we're also going to look at development, stimulation, maintenance, which is trophy. And translated is desarrollo, estimulación, mantenimiento, which is trofia. So if you see that, you're going to know atrofia, okay, which is stringage of muscles, basically. Dolor is pain, which you will probably see as alia, algesia. So for example, if you happen to see the words in Spanish, mialgia, atralia, it's a pain. A form of pain. Okay, so all this to show you that if you come across any Spanish words and if you catch that prefix or if you catch that suffix and you can catch that at least, you're going to be able to know and understand what either somebody's trying to tell you or what. All right, let's talk about cancer terms now. Benign is benigno, lower level, nivel bajo. Radiosensitive, radiosensible. No metastasis, no metástasis, well distinguished, bien distinguido. Negative nodules, nódulos negativos. In remission, en remisión. Surgically removable is quirúrgicamente removible. So there's some of those terms for cancer. All right, so this week, don't forget you've got a practice exercise. I will be posting the answers to that as soon as everybody has posted. Make sure you take your terminology test, and when I say practice exercises, I'm talking about the Blackboard discussions as well. So once again, this lesson is a little different from the rest. I hope you enjoyed it. Pause it as needed. It's all about memorization, memorization, memorization. And I'll see how well you guys perform on the discussion board and your quiz. See you next week.